I will talk about session 11 to 14, and this would include the steps 5 to step 10 of the 10 steps of a successful breastfeeding practices. We now go to session 13, maternal health concerns. At the end of this session, the participant will be able to discuss nutritional needs of breastfeeding mother, outline how breastfeeding assists in child spacing, discuss breastfeeding management when the mother is ill, and review basic information on medications and breastfeeding. Nutritional needs of a breastfeeding women. Here is a scenario. Fatima's mother told her that she needs to eat special foods to make good milk and that some foods can affect her baby. So, ask, what can you say to a woman who asks about what she should eat or avoid eating when she is breastfeeding? All mothers need to eat enough foods and drink enough fluids to feel well and be able to care for her family. If a mother eats a variety of foods in sufficient amounts, she will get the proteins, vitamins, and minerals that she needs. Mothers do not need to eat special foods or avoid certain foods when breastfeeding. A woman's body stores fat during pregnancy to help make milk during breastfeeding. She makes milk partly from these stores and partly from the food that she eats. A mother needs to be in a state of severe malnutrition for her breast milk production to decrease significantly. If there is a shortage of food, she first uses her own body stores to make milk. Her milk may be reduced in quantity and slightly lower in fat and some vitamins compared to that of a well-nourished mother, but it is still good quality and can be given to her baby. Or for choices or missing a meal does not reduce milk production. However, a mother who is overworked, lacks time to sleep or eat, and does not have sufficient food or lacks social support may complain of tiredness, and this would cause low milk supply. Care for the mother and time to feed the baby frequently will surely ensure adequate milk production. Breastfeeding is important for food security for the whole family. If there are if the resources are limited, it is better to give mother food so that she can care for her baby than to give artificial feeds to the baby. So you have to discuss this with the family. Breastfeeding mothers often encouraged to drink large quantities of fluid. Drinking more fluid than is needed for thirst will not increase your milk supply and may even reduce it. A mother should drink according to her thirst or if she notices that her urine output is low or how breastfeeding helps to space pregnancies. So here is a scenario. Fatima has heard that breastfeeding helps to space her pregnancies, but she wants to know if this is true. So, what can you tell a mother about how breastfeeding helps to space children? Explain this method to the mother. Breastfeeding can delay the return of ovulation and menstruation, and thus can help to space pregnancies. The lactation amenorrhea method, or LAM, helps women who wish to use breastfeeding for child spacing. The LAM method is 98% effective in preventing conception if three conditions are met, and these are: the mother is not menstruating, and the mother is exclusively breastfeeding day and night with no very long intervals between feeds, and the baby is less than 6 months old. Ask the mother the following questions to determine if the LAM method is effective. First, have your menses returned? If the answer is no, you proceed to the next question. Are you supplementing regularly or allowing long periods without breastfeeding, either day or night? If the answer is no, proceed to the next question. Is your baby older than 6 months? If the answer is no, there is only 1 to 2% chance of pregnancy at this time. But when the answer to any one of these questions becomes yes, there is an increased chance of getting pregnant in the mother. For continued protection, advise the mother to begin using a family planning method that will not interfere with breastfeeding. Spotting or bleeding during the first 8 weeks or 56 days postpartum is not considered a menstrual bleed. Intervals between breastfeeds should not exceed 4 hours during the day and 6 hours at night. Supplemental foods and liquids should not replace a breastfeed. So as we have mentioned earlier, if any of the three conditions are not met, such as amenorrhea, avoiding supplemental to the baby, or the baby is less than 6 months, then it is advisable for the mother to use another method of family planning to achieve pregnancy delay. Most family planning methods are compatible with breastfeeding with exception of estrogen contraceptive pills. So, what can we offer are the non-hormonal method of family planning, such as the use of your internal condoms, use of sponge, IUD, cervical cap, or offering tubal ligation to the mother and vasectomy to the father. So, breastfeeding management when the mother is ill. Another scenario. Fatima has heard from a neighbor that if a breastfeeding mother gets fever or needs to take any medications, then she must stop breastfeeding. So, what can you tell a mother about breastfeeding if the mother is ill? Women can continue to breastfeed in nearly all cases when they are ill. There are many benefits to continuing breastfeeding during illness. A woman's body makes antibodies against her infections, which these antibodies go into the breast milk and can protect the baby from infection through breastfeeding. Suddenly, stopping breastfeeding can lead to sore breasts, and the mother may develop fever. A baby may show signs of distress, such as crying a lot, if breastfeeding suddenly stops. It may be difficult to return to breastfeeding after the mother has recovered, as her milk production may have decreased. But stopping breastfeeding leaves the baby exposed to all the hazards of artificial breastfeeding. Breastfeeding is less work than preparing formula, sitting up to feed, and sterilizing bottles. The baby can lie beside the mother and feed as needed without her moving. Mother and baby can stay together, so she knows her baby is safe and happy. The baby continues to receive the benefits of breastfeeding. It protects health, gives best nutrition, and it is optimal for the growth and development and it is less of risk of obesity and later health problems. Mother with chronic illness may need extra help to establish breastfeeding. For example, a mother with diabetes may experience complications during delivery, which can interfere with establishing breastfeeding, but with appropriate help, she can breastfeed normally. To assist breastfeeding when a mother is ill, explain the value of continuing to breastfeed during her illness. So minimize separation, keep the mother and baby together, give her plenty of fluids, especially if the mother has fever. Assist the mother to find a comfortable position for feeding or show someone else how to help her to hold the baby comfortably. If breastfeeding is difficult or the mother is too unwell, she may be able to express her milk, and the baby can feed breast milk through cup feeding until the mother is feeling better. So choose treatments and medications that are safe for breastfeeding. Assist the mother to reestablish breastfeeding after she recovers if there has been an interruption during the illness. You have to ask, are there any situations related to the mother's health that may require the use of foods other than breast? There are very few situations related to maternal health that require the use of artificial feeds. It is important to distinguish if it is the illness that is a contraindication to breastfeeding or the situation surrounding the illness that makes breastfeeding difficult. Hospitalization of itself is not a contraindication to breastfeeding. If a mother is not able to care for her infant, a family member can be asked to stay and help her with the infant to continue breastfeeding. Even in situations of tobacco, alcohol, and drug use, breastfeeding remains the feeding method of choice for the majority of infants. When hard drugs users are concerned, decisions should be made on a case-to-case basis. Breastfeeding is not recommended for women or mothers who are intravenous drug users. If a mother has a contagious illness such as chest infection, sore throat, or gastrointestinal infection, there is a risk to the baby from being near the mother and exposed to the infection through contact, coughing, and as such. When the mother continues to breastfeed, the baby receives some protection from the mother's infection. But if breastfeeding stops at this time, the baby is at a higher risk of contracting the mother's infection. For most maternal infections, including tuberculosis, hepatitis B, and mastitis, breastfeeding is not a contraindication. If a mother is not able to breastfeed, efforts should be made to find a wet nurse which has an HIV negative status or to obtain a heat-treated breast milk from a breast milk bank. If the mother has HIV or AIDS, these are the recommendations for HIV positive women from the UNICEF or WHO. When replacement feeding is acceptable, feasible, affordable, safe, and sustainable, avoidance of all breastfeeding by HIV-infected mothers is recommended. Otherwise, exclusive breastfeeding is recommended during the first months of life and should be then discontinued as soon as it is feasible. Each woman who is HIV positive needs a one-on-one discussion with a trained person to help her decide the best way to feed her child in her individual situation. So, in summary, nutritional needs of breastfeeding women are the following. All mothers need to eat enough foods so that they will feel well and be able to care for their families. Mothers do not need to eat special foods or avoid certain foods when breastfeeding. If the food supply is limited, it is better for the health and nutrition of both mother and baby and less expensive to give the mother food so that she can care for her baby than to give artificial feeds to the baby. How to help the mother to space pregnancy. The LAM method is the 98% effective if three conditions are met. The mother is not menstruating, the mother is exclusively breastfeeding with no very long intervals between feeds, and the baby is less than 6 months. If any of these three conditions are not met, it is advisable for the mother to use another family planning method to prevent pregnancy. You can assist breastfeeding during maternal illness by explaining the value of continued breastfeeding during the maternal illness. Minimize separation and keeping the mother and baby close together. Give plenty of fluids, especially if the mother has fever. Assist the mother to find a comfortable position when breastfeeding. Assist the mother to express and feed the baby the breast milk through cup feeding if the mother is too unwell to breastfeed. Choose treatments and medications that is safe for the breastfeeding mother. Assisting mother and baby to re-establish breastfeeding when the mother recovers if she has not breastfed during illness. If a medication is needed, use one that is safe for the baby. Most drugs pass into breast milk only in small amounts and few would affect the baby. In most cases, stopping breastfeeding is more dangerous to the baby than giving medications. Watch the baby for side effects and find out more about the drug if you are worried. Babies under 2 months of age are more likely to show side effects. Know where to get more information or advice on the medications used. If the mother is taking a small amount or a small number of medications such as antimetabolites, radioactive iodine, or some antithyroid medications, breastfeeding should stop during therapy. Some medications may cause drowsiness and other side effects in the infant. Whenever possible, choose a medication that is safer and monitor the infant for the side effects while continuing breastfeeding. In situations of tobacco, alcohol, and drug use, breastfeeding remains the feeding method of choice for the majority of infants. If a mother is an intravenous drug user, breastfeeding is not indicated. For HIV-infected mothers, when replacement feeding is acceptable, feasible, affordable, sustainable, and safe, avoidance of all breastfeeding by HIV-infected mothers is recommended. Otherwise, exclusive breastfeeding is recommended during the first few months of life, and then it can be discontinued as soon as the specified conditions are met for replacement feeding. Mixed feeding, or meaning breastfeeding and giving replacement feeds at the same time, is not recommended among HIV-infected mothers. Breastfeeding is not recommended in the presence of breast abscess. But milk should be expressed from the breast. You can resume breastfeeding once the abscess has been drained and antibiotics were started. Breastfeeding should be continued on the unaffected breast. The presence of herpes simplex type 1, you can refrain from breastfeeding until all active lesions of the breast have resolved. In case of varicella zoster, discourage breastfeeding for a while the mother is infectious. But breastfeeding should be resumed as soon as the mother becomes non-infectious. In the presence of Lyme disease, breastfeeding may be continued during mother's treatment. The presence of HTLV1, breastfeeding is not encouraged if safe and feasible options or AFAs for replacement feeding are available. In the presence of hepatitis B, you can continue breastfeeding. Give hepatitis B vaccine within the first 48 hours as soon as possible thereafter. Breastfeeding by the TB-positive mother should be discontinued as usual, but you have to manage both the mother and the baby accordingly. In the presence of mastitis, you can continue breastfeeding during antibiotic therapy. So, contraindications for breastfeeding would include the use of anti-metabolites or anti-cancer drugs by the mother, or the mother is using radioactive substances wherein breastfeeding should be stopped temporarily. Continue breastfeeding in the following situations. If the mother is taking psychiatric drugs and anticonvulsants, you have to monitor for the possible side effects of these drugs. Monitor baby for the presence of drowsiness. If the mother is using chloramphenicol, tetracyclines, metronidazole, quinolone antibiotics such as ciprofloxacin, use an alternative drug if possible and continue breastfeeding. If the mother is taking sulfonamides, dapsone, sulfamethoxazole plus trimethoprim, sulfadoxine plus pyrimethamine or Fansidar, you have to monitor for the presence of jaundice among infants and continue breastfeeding. If the mother is using estrogens, including estrogen-containing contraceptives, thiazide, diuretics, ergometrin, use an alternative drugs because this may decrease milk supply. We can continue breastfeeding. The following medications are safe in the usual dosage. First, analgesics and antipyretics. Short courses of paracetamol, acetylsalicylic acid, and ibuprofen, or occasional doses of morphine and pethidine. Antibiotics are also safe during breastfeeding, such as the use of amoxicillin, ampicillin, loxacillin, and other penicillins, or the use of erythromycin. It is also safe to use anti-tuberculous drugs, anti-leprosy drugs during breastfeeding. Anti-malarial drugs, antihelminthics, and antifungals are also safe, except for the use of mefloquine and Fansidar as anti-malarial drugs. The use of bronchodilators such as salbutamol, corticosteroids, antihistamines are safe in the usual dosage. Antacids, drug for diabetes, most antihypertensives, digoxin can also be used during breastfeeding. Nutritional supplements of iodine, iron, and vitamins are also safe in the usual dosage. This ends my lecture. Thank you for listening.